Hi everyone, Dr. Shauna Kalika with Depth Medicine. Today I'm going to highlight two really beautiful aspects of using homeopathy in clinical practice. So homeopathy is a natural medicine that is not often used or talked about in the clinical world, but it is used in about 95% of my cases, and so it does take up the bulk of my treatment plans. And I recognize I need to do more patient education around it as well, so that is on my back burner. But for now, I do want to talk about two really important things that came out of a recent case. So the first one I want to point out has to do with, excuse me, a necessary aspect of using homeopathy and making it efficient and effective in its treatment, as well as what makes homeopathy stand out as a medicine. That's the first piece. And then the second part is really just the beautiful outcome that comes out of using homeopathy. So the first piece is regarding how a person or how a clinician comes to a decision on prescribing. So the thing that makes homeopathy stand apart from really any other medicine is that it's less interested in the generic diagnosis, broad spectrum symptom picture, and it's way more interested in, and it necessitates an understanding of the specificity of a patient's experience of a symptom. So to say, for example, in my patient's case, that they have anxiety and depression is way less useful and definitely not, so sorry, I have a little bit of smoke from my fireplace. It's definitely not enough information to use for any prescription for homeopathy. What's needed is how the anxiety and depression is looking and manifesting within the patient's life and personal experience. So in this case, my patient was having, has been in a position of caretaking for their parent who has a mental health condition that is poorly managed. But my patient has had to be in the role of responsibility for not only managing and taking care of their parent, but not having a lot of help to do so. They are also a busy parent in their immediate family, and so my patient also has the normal day-to-day responsibilities of raising children and being a co-parent. So in my patient's case of anxiety and depression, there was a particular picture that was starting to evolve as we were moving through our analysis. Her main underlying experience of her anxiety depression was overwhelming. Well, I was going to say overwhelmment, and then I chose not to. As a stolen word from James Hollis, if you guys know the depth or Jungian analyst James Hollis. Sorry, I digress. I love this word overwhelmment. It should be a word. Her overwhelming, her main symptom is the feeling of being overwhelmed. It was manifesting by way of feeling like she was constantly on the verge of tears. And this would specifically show up even just when she would start talking. So this is where it starts to, if you think about it like a funnel, it's like you have anxiety, depression, and then you have feeling overwhelmed, and then you have feeling being on the verge of tears all the time, and then you have, it always shows up when I start talking, right? Like that's really very specific about how this person is feeling with regard to calling it anxiety or depression. This would be very different than somebody who, let's say, was constantly feeling amped up all the time with their anxiety and depression, that they were so busy they couldn't stop themselves, and they would just crash into bed the next night and wake up with just this spike of cortisol, jumping out of bed, could never slow down enough to feel anything. They were numbed out emotionally, and they were just going from one thing to the next. Now, the level of busyness would be equal between the two people, as my patient is very busy. And going. The difference is that my patient is identifying with how she feels, and it's starting to slow her down and bring her into a state of like can barely function. So this is what's narrowing the option, the possibilities of which homeopathic remedy I would use to treat her, because her remedy has to match her and her specific current presentation of symptoms. So this is the picture that's starting to form. In addition to this, she was feeling like she couldn't bear the situational circumstances surrounding her levels of responsibilities. There was a lot of angst around the circumstances, and again, I have to be, of course, protective, so vague, that were making it difficult for her to feel hopeful. Now, I said the word feel because a lot of us can identify with the importance of being hopeful, but sometimes we're in a more intellectual state about that than we are a feeling state of that. And I want to highlight that because not only is this an important piece of awareness when seeing how well a homeopathic remedy is working, is that we're able to feel things again, but also to recognize that we do go between states of feeling the things that we think and believe, and sometimes having to just rely on it from an intellectual perspective. I think a lot of people refer to this as like keeping the faith or holding on to hope, that kind of thing. So this patient, my patient, was not in a state of feeling hopeful, but she was very frustrated by her circumstances. And it was showing up in a very heightened sensitive state. So I'm hoping this is sort of helping tease apart sort of the objective pieces of like saying I'm anxious or saying I'm depressed. You know, there's the more common sides to that, which is like I'm not finding a lot of joy in life anymore. It's really difficult for me to experience happiness. These are your more general, generic descriptions. I'm very fatigued. I have a really hard time getting up in the morning. Those are very common and less easy to treat because there's so much less specific. In my patient's case, I'm getting a lot more specificity from her due to the timing of when the desire to cry shows up. Oh, and another piece that I didn't mention either that's specific is that after she cries, she does not feel better. So there are cases when we will cry and feel alleviated. There could be an overwhelming a sense of peace and calm. It might help induce sleep for someone. A person could feel lighter. The crying can be a sort of a endorphin release for someone. In her case, that was not happening. So again, knowing that she was not alleviated or ameliorated following crying reduces and limits the number of possibilities of remedies that I could use to treat her that would be effective. So we're going to fast forward 2 months after treatment, and my patient looks and sounds like a completely different person. She not only looks brighter and lighter and happier, but she's reporting immediately, noticing that her emotions are way more controllable. And she just sort of goes off on this like beautiful description of how this is impacting her life in a very detailed way. So it's brought up a lot of awareness for her. She's recognized and resolved to accept the circumstances around caring for her parent that were beforehand so frustrating and difficult because she didn't have a lot of control over it. Now she's accepting it for what it is. She sees it for what it is. And then it led her to be able to find the capacity and desire to set boundaries that were really necessary in her relationships. And as a result of that, she was recognizing the health and calmness and happiness it was bringing into her, not only extended family relationships revolving around caring for her parent, but also her immediate family with her children and her partner. And then she reported she didn't feel like she needed to cry. She was able to talk, get through her day, get things done, and have this basic level of stability. She felt hopeful. It wasn't just a state of mind, but rather it was a felt experience. And she just felt like she was doing well and nothing had changed in her circumstances. Her roles and responsibilities were no different. She didn't introduce any new medications or supplements, or there was nothing new under her treatment plan. She didn't start seeing a therapist. Again, there were no variables that were new variables that were introduced into her plan, but rather just the natural effects of taking a homeopathic medicine that matched her specific experience that allowed her to move into this really stable, healthy state. So anyway, I wanted to share that with you guys. I hope this was interesting in some way. If any of you would like to schedule a free consult, please do so. Again, this is just one of the treatments that I use in my work with people treating depression and or chronic illness. And I'm always meeting you where you're at, treating symptoms as you experience them personally. So I hope you guys have a great night, and I'll see you again soon.